The arterial anatomy of the lower limb is a complex network of vessels that supply oxygenated blood to the muscles, bones, and other tissues of the lower extremity. Understanding the key arteries and their branches is essential for clinical practice and surgical procedures. Below is a detailed overview of the arterial anatomy of the lower limb. TAS 1. Abdominal aorta and common iliac arteries. The abdominal aorta bifurcates at the level of the L4 vertebra into the right and left common iliac arteries. Each common iliac artery further divides into internal iliac artery, supplies the pelvic organs and structures. External iliac artery continues into the lower limb as the femoral artery. Femoral artery. The external iliac artery becomes the femoral artery as it passes under the inguinal ligament. The femoral artery runs through the anterior compartment of the thigh and gives off several branches: superficial epigastric artery, superficial circumflex iliac artery, superficial external pudendal artery, deep external pudendal artery, profunda femoris artery, deep artery of the thigh. This is a major branch that supplies the thigh muscles via lateral circumflex femoral artery, medial circumflex femoral artery, perforating branches. The femoral artery enters the adductor canal and exits through the adductor hiatus to become the popliteal artery. 3. Popliteal artery. The femoral artery transitions into the popliteal artery as it passes through the adductor hiatus into the popliteal fossa. The popliteal artery gives off branches that supply the knee joint and surrounding tissues. Genicular arteries, superior, inferior, and middle branches. At the lower border of the popliteal fossa, it divides into anterior tibial artery, posterior tibial artery. 4. Anterior tibial artery. This artery runs in the anterior compartment of the leg and supplies the anterior leg muscles. It passes through the interosseous membrane and descends along the tibia to the ankle, where it becomes the dorsalis pedis artery on the dorsum of the foot. 5. Posterior tibial artery. The posterior tibial artery runs in the posterior compartment of the leg and supplies the posterior leg muscles. It gives off the fibular peroneal artery, supplies the lateral compartment of the leg and fibula, medial plantar artery, and lateral plantar artery. These are terminal branches that form the plantar arch in the foot. 6. Dorsalis pedis artery. The dorsalis pedis artery is the continuation of the anterior tibial artery. It supplies the dorsum of the foot and contributes to the formation of the arcuate artery and smaller branches that anastomose with the plantar circulation. 7. Plantar circulation. The medial plantar artery and lateral plantar artery arise from the posterior tibial artery. These arteries form the deep plantar arch, which gives rise to the plantar metatarsal arteries and digital arteries that supply the toes. Anastomoses. The arteries of the lower limb form several anastomoses to ensure collateral circulation. Genicular anastomosis around the knee. Ankle anastomosis between the anterior tibial, posterior tibial, and fibular arteries. Plantar and dorsal anastomoses between the dorsalis pedis and plantar arteries. Clinical relevance: peripheral artery disease. Commonly affects the lower limb arteries, particularly the femoral and popliteal arteries. Dorsalis pedis pulse, clinically palpated to assess arterial supply to the foot. Popliteal aneurysm. The popliteal artery is prone to aneurysms, which may compress surrounding structures. Critical limb ischemia involves obstruction of major arteries, often requiring revascularization. Understanding the detailed anatomy of these arteries is vital for diagnosing and managing vascular conditions and performing surgeries in the lower limb.